A shortage of baby formula is pushing some moms to consider moving away from formula, depending more on their own milk.
Some are doing it for themselves, while others out there are trying to make formula more available to others. News specialist Mike Anderson talked with some of the lactation consultants who are helping them out. Mike?
Yeah, Mike and Dini, here at the University of Utah Health, the lactation team says they're not necessarily seeing more clients, but rather getting more phone calls and questions. It's similar in other places, too, where the questions are focused around finding ways to depend less on formula.
Caring for a new baby can be stressful enough.
It's hard to say where we've maxed out on stress between pregnancy and birthing during a pandemic.
As Sally Wright explains, there's plenty to add to that challenge, especially now when you add in that formula shortage.
This one just feels like one more on top of that.
An international board-certified lactation consultant who works with MotherFed, she says right now that shortage is drawing some concerns about what could happen in the weeks ahead.
The difference that we're seeing with the formula shortage is just the tone that those questions are presented in, because now there's a little bit of fear that they might need something that they can't get.
Wright says questions over production are not new. It's the reasons why that have changed. Meantime, at University of Utah Healthcare, they say call volumes are up.
We all look at this as it would be terrifying to be a new parent and to not know if you're going to have the food needed for your baby.
And as far as producing more human milk using less formula, they say the advice hasn't changed much. There's no secret drink or supplement.
There is nothing that will increase milk production like frequent removal of milk to send the body the signals it needs to produce more milk.
That transition is gradual. It's not an instant fix, but they say there is a wide variety of resources here in Utah for moms facing varying challenges during this shortage.
With adequate support, a lot of that stress can be eliminated.
And while University Health again says they're not seeing an influx of new patients in the lactation team, they are preparing for that just in case. And they also add that they're getting calls about whether they can give out formula. They say, unfortunately, once mom is discharged from the hospital, they cannot.